The next several weeks to months is going to be very, very good in terms of the vaccination front.
From doctors on the front lines to politicians in the halls of power, the reaction to the approval of a third COVID-19 vaccine for use in Canada was unanimous.
I think it's the best news we've heard in a real long time, and the two questions we need answered is when we're getting it and how much we're getting.
Canada has a contract for 22 million doses of the Oxford-AstraZeneca vaccine, some of which are part of a deal with the Serum Institute of India. And the first shipment will be significant.
500,000 doses will be delivered to Canada in the coming days.
The Pfizer-BioNTech and Moderna shots are mRNA vaccines, but Oxford-AstraZeneca's is a more conventional viral vector vaccine, which can be stored at temperatures between 2 and 8 degrees Celsius, meaning it can travel more easily and be administered in your doctor's office or a pharmacy. But there's one stat some are stuck on. This vaccine has a 62% efficacy rate, much lower than the two already approved in Canada. Dr. Supriya Sharma says you need to dig a little deeper into the science to understand what this all means.
The number of cases of people that died from COVID-19 that got vaccine was 0. The number of people that were hospitalized because their COVID-19 disease was so severe was 0.
Doctors point out, depending on the year, the seasonal flu shot is only about 60% effective. The point of the COVID-19 vaccine isn't just to prevent you from getting COVID-19, it's to reduce the effects of the virus.
It's a huge public health win, transforming a severe illness into something that's very mild and easily dealt with by your immune system.
And that could come even quicker with the approval of the Johnson & Johnson single-dose vaccine. Health Canada officials say the review of that vaccine is in the final stages, but they don't expect any announcement in the next few days. Robin.
Mike Couteur in Ottawa. Thanks, Mike. More Canadians are being vaccinated, but case numbers are on the rise in 3 of Canada's biggest provinces. Daily case counts in Ontario, Alberta, and BC have increased between 8 and 14% over last week. The same 3 provinces are reporting the highest number of infections involving those concerning variants.
Given a much narrower margin of error with these variants, controlling the epidemic would be much more difficult.
That rise in variant cases is putting more pressure on protecting vulnerable Canadians. Some in the medical community are calling for a new rollout strategy that considers delaying the second dose. Heather Yourex-West looks at the risks and possible rewards.
At this vaccination clinic in Laval, Quebec, the race to protect as many vulnerable seniors as possible is on. It's currently open to anyone 85 or older. 88-year-old Fernand Beaupré says his kids made him come.
They said you have to get vaccinated. We don't want to lose you.
Quebec is handling vaccine rollout differently than other Canadian provinces. Along with New Brunswick, Quebec has decided to get more first doses into people's arms by delaying a second dose by as much as 90 days.
When you're in a vaccine-limited setting, as we are in Canada at the moment and will be for the next few months, we can effectively vaccinate twice as many people.
It's a strategy that so far appears to be paying off in the UK. Britain became the first country in the world to approve a 12-week interval between doses. Not only does more than a quarter of its population now have at least one dose, spacing the second dose, at least with the Oxford-AstraZeneca vaccine, appears to improve the vaccine's efficacy as well.
They've released some preliminary data showing that they have a 12-week interval between doses, and that seems to be more protective than the initial recommended time between doses, which I believe was 6 weeks.
There is also evidence that a single dose of either the Pfizer-BioNTech or Moderna vaccine provides good protection too.
In healthcare workers, we could see a protection in the range of 80% that started about 14 days after being immunized. Whereas for long-term care facility residents, it took a little longer, about 3 weeks before this protection kicked in.
There are risks to extending the interval between doses. The science on this is essentially being done in real time. But with the spread of variant cases increasing the threat of a Canadian third wave, missing the chance to get more people vaccinated sooner carries a risk as well. Heather, Yourex-West, Global News, Calgary.